Hey everyone, I'm Tiffany, and this is the first video that I'm kind of putting out to kind of document our journey with my two kids, Leilani and Aiyana. And Aiyana's diagnosed with trisomy 18. She has a really rare form of it. And so this is a quick 37-week update, and I'll do another video kind of going back through the pregnancy and how we found out about the diagnosis and all of the different things that we've had to experience along the way. And my hope is that other people with trisomy out there can relate, and those that don't will better understand this diagnosis and how it affects families. And to kind of start off, this week is actually a big one for all the friends and family who know about my updates just with, in my own private networks. Most trisomy babies do not make it to term. And she is 37 weeks and 3 days inside my tummy, which is huge. Everybody told me honestly, the first week, every single week after that she was going to pass away, that I would miscarry, I was threatened miscarriage, all these different things that were happening. And they said, the main thing is they say incompatible with life. You'll hear that a lot when talking about trisomy 18. But what I've come to kind of see through my experience and also connecting and learning about other trisomy families and the genetics of it is that it's actually more of like a spectrum, just like autism or Down syndrome. Down syndrome is trisomy 21, so they're in kind of the same family. And really, when you look at that, if you try to think how people perceived, autism and trisomy 21, which is Down syndrome, how they perceived that back when it first started, or when it was first discovered, even, 15, 20 years ago, I'm sure the public perception of it was similar to how trisomy 18 is now. And there's a lot of misunderstanding about it. There's a lot just unknown about it. There's not a lot of research on it. So that leads the medical community to kind of push you to, make decisions that may not be what you want to do, termination and things like that. But my choice to continue with the pregnancy was one that I intentionally made because I felt like that was just what she was supposed to do. I don't really know how to describe it. It's just a feeling that I had, when thinking about termination, because I did think about that very, very seriously, because I didn't want her to suffer, and I did not want to be continuing a pregnancy or prolonging her life just for my own selfish reasons of not wanting to let my child go. But the choice to continue with the pregnancy was really more a gut feeling, is like the only way I can describe it. Just felt like she had a bigger story to tell, and even if that was going to be a short one, because the life expectancy for trisomy 18 kids is statistically pretty short. The statistics are terrifying. I think it's almost 85% are usually either not born alive, or stillborn, or pass away pretty quickly after birth. And I think it's less than 10% will make it past their first birthday. So statistically, it's very grim. But then when you start connecting with other families, you see, yes, there are a lot of kids who pass away, but there are also kids who are thriving and they are participating members in their families. It's not the picture that you imagine it to be isn't what I've seen so far. And what I usually picture is, someone just suffering and pain, and that's what was in my mind when I was thinking about termination, because I didn't have any other perception but to go off of what doctors said. So The fact that she is 37 weeks and 3 days and continues to baffle all of the medical people that have been working with us, who have been amazing, by the way. Um, it's pretty amazing. It's a big week. And besides her regular issues, I'll go into more extensively in another video, but I mean, all the regular things are still there. She still has the brain issues. She still has heart issues. VSD is still there. She has a cleft palate back in her soft palate. That's still there. Her femur bone is a different size than the rest of her body. She's still fetally growth restricted. But she also made it to 5 pounds, which is also major, especially for being growth restricted, which is common to trisomy 18. And, I just was so happy to get out of the 4 pounds. I mean, every time we break into the next number, it's just, like I say, my prayers and thanks and blessings that we're doing that, because every ounce, I think, is going to help her to be strong and be able to fight when she's outside of the womb and doing what she needs to do. And God forbid if she isn't supposed to fight and she's supposed to, her life is supposed to end sooner than I would like it to, I have made peace with that as well, and understand that it's not going to always be how I want things to be. But what I do know is I have zero regrets. I've done everything I can do to listen to my instincts, listen to God, and listen to what this baby is telling me through all of her different signals and movements. She moves all the time. Her heart rate is strong, and she just lets me know that she's constantly there, and she's trying to do her best. So as long as she is doing that, then I'm going to keep pushing as well. And once we reach the point where she's not able to do that, then I will also be there to let her know that it's okay for her to go as well. So that's pretty much, this week has been huge. But I also got a little bit of news today that my doctor here locally, because I have 2 sets of doctors. One is here locally in the Rio Grande Valley, down in South Texas, and our specialists are all up in San Antonio. So I've been going back and forth for a long time, and now I've just been, probably for the past couple months, been seen here locally, and then they send everything up to my doctors in San Antonio, and they correlate back and communicate what they think should happen. And today, my doctors in the valley here let me know that their office is going through a kind of a transition of ownership. And with my due date on September 25th, that they are going to have a 2-day lapse in malpractice insurance on the 15th and 16th. So they told me that, which is, of course, how things are going to go for me. It seems to be the theme lately. But basically, I have to make a decision on if I'm going to deliver here, if I want them to induce early, like the day before the malpractice insurance goes, if I want to have a different OBGYN on call, should I go into labor, or just leave it up to God and the universe and hope that it all works out and that I don't go into labor and that it's a non-issue. So I have to think about that and make a decision, the couple days next week. So, yeah, other than that, things have been going good. Leilani is doing really well. She's 21 months and cutting some last molars that she has coming in, and has been sleeping a ton. And everyone who has, a 2-year-old toddler knows when they're cutting teeth, it's pretty crazy. So she's got a lot of emotions, and for whatever reason, these teeth that she's cutting have made her very, very sleepy, which has been nice, because usually she's the opposite. When she's cutting teeth, she won't sleep. So I'm excited to have some time with her tomorrow and do some fun things together before we enter into the crazy couple weeks ahead. So basically, we're on a countdown, and we're just watching and waiting to see what Miss Aiyana decides to show us, which will tell us what we need to do, if we need to induce early for medical reasons, or if she's just gonna stay in there content and come out on her own when she's ready, which would be amazing because then she can grow some more. And every little ounce counts, especially when it comes to lung development and other things. I think that would be major for her if she could stay. So that's what I'm praying for. So I think that's everything for this week. We're going to go into next week and continue the weekly monitoring. I go a few times a week to do different scans, growth and biophysical profiles, and they just kind of keep tabs on everything.